Hello, I'm Mrs. Savita Kale. I'm an ENT consultant working at Hereford County Hospital. The last 12 months have been very challenging with the pandemic, and being an ENT consultant, I have been working in the upper airway and dealing with patients with ear, nose and throat problems, cancers and airway problems, and doing operations. I have had to put telescopes down patients' noses, and the concern about exposing myself to COVID and the virus. The Trust and the NHS have really looked after us by giving us safe PPE equipment. But when the vaccine came out, it was time for me to think about helping myself as well. I did look at the original paper published in the New England Journal of Medicine and looked at the Pfizer trials. And fortunately, when they have done trials in people with Black, Asian, ethnic minority people, and I was quite satisfied with the trials and also that it's peer reviewed. And hence, I put myself up for having the vaccine. And that is how I thought I can help myself to keep myself fit and look after my health, but also to continue looking after the patients, because we still need all hands on board. So I would like to encourage and say that the vaccine is quite safe to have. My family is consists of three of us in the front line as healthcare workers, and my husband and my son have both had the vaccines as well. There has been the concern that the vaccine may affect us adversely, but also there have been statistics that the Black, Asian, minority, ethnic may suffer with COVID even worse than the others. And hence, I think it's justified to consider the vaccine. I have looked at the paper, I've read the papers, and there does not seem to be any evidence of any animal protein or like pork, and there is no live virus, and there are definitely no chips in it. So I think taking the vaccine is a safe option. One is, it does not totally prevent us from getting the virus, but from the evidence, it suggests that it may be mild. I have seen patients who have suffered with severe COVID and sadly even death. But if we take the vaccine, there is a chance that we may not have long COVID symptoms and may not have the complications that arise after we've been ventilated and suffered in the ITU as well. So I think my encouragement is to consider the vaccine for all of us, so that we can start leading a normal life and we can actually hug our loved ones, which we really miss.